Hi, this is Dr. Scott Munsterman, and welcome to the iPatient Care EHR Implementation Plan. And so what we want to be able to learn from this particular module is the overall process, the overall plan of implementing the iPatient Care EHR system into the practice. And so what you'll see on this slide is this slide tells us a lot of information about the whole process. First of all, at the top where you see in blue, you see collect practice vitals. That's the very first step that we have with clients, is that as we get to know them on that first welcome call that we have, we begin right away collecting all of the information that we need to get a platform set up specifically for your practice. Now, some of that information is going to include who the providers are, their NPI numbers, the address of the facility, different locations that you may have, so on and so forth. And as we collect all that information, then what we do is that we pass that on to iPatient Care engineers, and then they begin to build out that platform, get it set up. There could be a requirement from you, the client, that you would like some data transferred out of your current system into this system. And so all of those details get worked out by the iPatient Care engineers, who are absolutely brilliant people. And as they work with that platform setup, they bring it to a point over time, and usually that could be anywhere from a week to 10 days to 2 weeks, maybe longer, depending on the difficulty of the data transfer. They will bring it to a point of what's called a live production, in which the clearinghouse then, which is integrated into the overall platform, which gives it a lot of great features, then that automatically begins to get set up. Now, during that time frame, from the time frame of when we collect that information from you, the client, provide that to iPatient Care, they build a platform out, and they get to the point of live production. During the course of that time, well, we've got a lot of work to do with you, and part of that has to do with an overall assessment of your practice, looking at your workflows, looking at what do you have for current technology and your capabilities within the practice, and then also collect more data. And we're going to talk a bit about that in more detail. Then we also have you get started in our pre-live training curriculum, which will cover the different roles that play out within the practice as they interface with the EHR platform. And so that's going to include front desk operations, scheduling, billing, EHR documentation. And then as we collect that data and that information, and then once that live production of the platform is available, then we begin that build out phase where we define and further refine the EHR documentation to your specifications as we've learned in the workflow assessment. We also build out those scheduler requirements. We make sure that everybody is able to log into the platform. And then we finalize the patient portal, the text and reminder system, appointment reminder system called iRemind, and then any further testing that we do in the billing and enrollment and fee schedules and insurance carriers. So that build out phase is where we get everything assembled, customized, and then tested. And once that all is working well, then we move it into the go live training phase, where we actually one-on-one work with you and help you understand how to document in the EHR, how the front desk operations work, how do you schedule, how do you bill, how do you use the patient portal, so on and so forth. And then that prepares you confidently to be able to go live. So let's talk about each one of these in just a little bit more detail. So the assessment and data collection, and remember this is a part of the process while the platform is being built. And so when you think about a three-leg stool, this is how many businesses are established, and especially within the clinical business environment. We have people, we have processes, and we have tools. And so if you are in a paper mode, or even if you are currently in another EHR system, you have people and you have certain provider types. There could be various provider types, like in a multidisciplinary clinic, or it could be a single provider type. You have clinical procedures performed by providers. You have clinical staff that do specific duties within the clinic, maybe direct patient care. You have administrative staff that have administrative duties, maybe like at the front desk or scheduling or billing. And so people occupy those specific roles within the clinical business. Next, we have processes. And so much of our time management hinges on our schedule. How do we schedule appointments? What are the time frames that we have specifically for specific types of visits and reasons for visits? We have our front desk operations, our way that we process new patients, a way that we process maybe established patients that have a new episode, a new injury. We have billing operations and depending on the insurance carrier and all of that. And so there's processes that are built. And then thirdly, we have tools. Now those tools many times take the paper form, paper intake forms, paper exam forms, paper outcome assessment tool forms, and other forms that help us with our process and connecting our people with our process. And so that workflow assessment, as you think about these three things, this three-legged stool, people, process, and tools, now you understand how your practice is operating today. And as you look at the new technology, technology is a tool, and it helps incorporate a process that is specific for people. And so as we work together, we're going to be bridging the way your workflow goes today and how does it fit into a technology that can help you create efficiency within your overall process. And a big part of that is for you to think about how you're doing things today, and that's called workflow process mapping. Think about the way you're doing things today and map out your current process so that you understand what you're doing today. The second point is that it's important for you to build awareness and understanding of the new technology, of the iPatient Care electronic health record technology, because when you understand what is available within that, then you can begin the process developing new workflows which will accommodate and accomplish the same end result, but many times with much more efficiency within this system, the iPatient Care platform. And so think through the workflow process mapping, and you'll see on this particular slide, and you'll have the PDF of this slide available with the hyperlink noted at the bottom of the slide. That will bring you into even a little more instruction on how to proceed with workflow process mapping. And so just as a basic example, a patient checks in, they sign in, there may be some paperwork, maybe they're paying at the time of visit, waiting, they were moved to the waiting room, or maybe a treatment room. Their visit may be for a new exam or maybe just a regular treatment. They'll have therapy or rehab, and then they check out. And when they check out, they may pay and schedule for a follow-up visit. And so as you think about flow, this is just one example on how do you begin to map out what that flow could look like. So in addition to workflow assessing, how are we doing things today, people, process, and tools, we also have a technology assessment that needs to occur, and that's taking a look at your current hardware. What is your internet speed? Use of the Chrome browser is very important for the iPatient Care platform. And then also judge as well, what is the overall provider and staff proficiency in general with technology? Are you currently utilizing email, other software applications, just the overall general knowledge? Some people come with more general knowledge about technology usage than others. And so gauging that amongst your staff can be a very important part of how we implement and how they can adopt this new technology. And then lastly, within this bit of work to do while the platform is being built is data collection. And so we're going to use this time to also engage you on getting enrollment forms completed and submitted. We are going to engage you on collecting the fee schedules from you that you have, your retail fee schedule or whole clinic fee schedule, in addition to the insurance company or payer fee schedules that you have available. We'll also need a list with all of the information regarding your payers, your insurance or carrier information, and that would be addresses and payer ID and the like. And then finally, information that we need to collect from you regarding appointment reminder messaging. And getting all of that information ahead of time can be very helpful and prep us to that build-out stage. And then finally, while we're waiting for the platform to be developed, we have available a pre-live training curriculum for you and your staff, and we urge you to take advantage of that. our clients are able to implement and adopt technology much faster if they are within this pre-live training curriculum. And that covers login process. It covers the process at the front desk within the system, billing processes, patient letters, informed consents, EHR documentation, and then other administrative training. And you simply go to bpaehr.com, click on the resource in the menu, and you will see EHR training videos that are divided by section. And we highly recommend that everybody within the practice has that under their belt prior to us getting to the point of doing live training. And as the platform does go live then, and we're in the live production phase, then we can begin that build out phase, because we've gained all the knowledge from you on the workflow assessment and technology assessment and just the data collection. And now we customize your EHR. So it has the macros that you want and that you need. We've got the note customized the way that you like it built out per provider, per procedures. We know what your scheduling requirements are, and we build that scheduler out. We provide you with login access, make sure that is working smoothly. The patient portal and iRemind, getting that set up. And then we further test your billing and your enrollment and your fee schedules and your insurance carrier, getting everything, all the rough edges knocked off so that this will flow smoothly. Finally, after the build-out phase has been done, then we can begin thinking about, okay, what is our strategy for go live? So what does that look like? How do we want to implement this as we begin to put patients in the system? And we just recommend that it's always better to be prepared than to rush, and evaluate what is the learning uptake and how is your proficiency proceeding over a period of days or weeks. As you think about that, what is the best way to approach it? Do we take baby steps, or are we used to EHR systems? And you know what? We can do this because we're very proficient at technology. It's going to vary depending on your capabilities within your practice and your unique situation. And so developing that implementation strategy, once we get through that build-out stage, is really when we take a look at, okay, how are we doing? Do we have any barriers? How should we approach this? And we consider those workflows, and we consider the training, and we consider the overall testing of the operation. That all helps us prepare for what that go live date is going to look like. And then we begin that go live training, and that is with the providers on the EHR documentation and the front desk operations and billing operations and patient portal. And so that's where we really get the one-on-one active question answer refining. But at the end of the day, there's a certain point that providers and staff need to be in the system every single day. There's an old saying that if you want to learn how to swim, you're going to have to get wet. And that's what this is really all about. We can talk about proficiency, we can talk about what to do or how to do it, but until you actually get into the water and get wet, that's when you really learn how to swim. And that's really where you're going to learn how to use this technology, is to be in it every single day, doing something in it, and gradually bridging yourself into a full-blown use of the technology. Now, just a couple of final words. There's a big difference between implementation versus adoption. And so implementation is what we've been talking about. Hey, we got things ready to go. We went through all the setup and all of that. But it's up to you to adopt. It's up to you to get wet, to have that continual process, stay informed, stay engaged. There will be times of where we need to step back and reassess and make changes and make updates. And that's just the way it is. And just so you know, going live does involve that ongoing monitoring of technology performance, but then there's also workflow updates. There's things that you're going to do different in the practice. I can guarantee you're doing things different today than you were 10 years ago or 15 or 20 years ago, and that's the way it will continue to be while your technology can adapt with you. And as I mentioned, there's going to be troubleshooting, things that need to occur periodically as you utilize any technology. And just so you know, we are here as your strategic partner in the practice to help you with that. And so it's good for you, after listening to this, to probably come back to this particular module a couple of times over the course of the next several weeks so that you can say, okay, where are we at today on this? When you take a look at this overall flow, where do you feel that you're at? Are we still in the data collection phase, or are we in the build-out phase, or are we into the go-live training phase? Everybody has a job to do within this particular workflow. iPatient Care has their job to do to help us get this platform engineered. You have a job to do to give us the information that we need in a timely manner. We have a job to do to get this thing built out and help lead you through this process so that you can move on, go live, and be able to utilize this successfully within your practice. And just know that the BPA EHR team is here to help. Active links are here. We have phone numbers. You can certainly give us a call. You can text me at 605-691-9930. That's my direct line. If you have questions or any types of concerns, please contact me and we will be right on top of it. Otherwise, all the team is very responsive. And again, if you have any questions or comments, just let us know. But we're looking forward to working with you as a client and helping you any way we can through the workflow assessment, technology assessment, data collection phase, through the pre-live video training phase, and then, of course, the build-out and moving into the live phase, while we have the best platform for you developed to meet your needs into the future. Thanks for listening.